Hi, everyone, and welcome to episode 145 of the Veterinary Behaviour Chat podcast. And today I thought I would have a chat to you about PVPs specifically for cats. And yet once again, this episode was inspired by a client call that I had last week, where we kind of discussed exactly this topic and what options or what different options that we have for pre-visit pharmaceuticals for cats. So I just want to start off by saying in this episode, I'm not going to dive too deeply into some of the more perhaps emergency type PVPs that might be sort of squirting dexmedetomidine or medetomidine, injectable liquid or ketamine into a cat's mouth onto their gums. I know that this absolutely is a really useful possibility for some cats where we need to kind of get urgent chemical control or chemical restraint, and it's really difficult to either touch the cats or get near the cats, where we want to administer something into the mouth that is going to be absorbed through the mucosal membranes. And I don't want to talk about that today. And there are a number of different medications that can be used for this purpose. So that ranges from some of the alpha-2 agonists, as I've just mentioned, such as medetomidine and dexmedetomidine, ketamine, opioids, buprenorphine can also be used in this way. We know that sublingual buprenorphine is something that we can use for cats. And there are other medications such as anti-epileptic drugs that can be administered in this way as well to cats. So that's what I'm not going to talk about today. So I really want to focus on what we would think about administering prior to a vet visit to a pet cat that was normally handleable, that we are able to administer medications to, and that potentially do get quite stressed at the veterinary clinic, and where maybe sort of the initial option that we might have tried didn't result in the desired effect. And that was exactly what happened in the case that I saw last week. Is gabapentin was administered to this particular cat at a dose of 100 milligrams per cat, which is a pretty standard dose, and didn't really reach the desired effect when the cat then ended up at the veterinary clinic. So we sort of chatted through a few different options, and I thought that would make a great topic for this episode. So let's maybe start with gabapentin, because honestly, for me, in my career, gabapentin has been an absolute game changer when it comes to reducing fear, anxiety, and stress in cats in the veterinary clinic. And I would say I probably started using gabapentin in cats at my clinic in Abu Dhabi shortly after the initial sort of paper came out about this. So we probably started using gabapentin in cats just before COVID, I think. So probably 2018, 2019. And in fact, the paper by Dr. Van Haaften that actually sort of documented the use of gabapentin for this came out in 2017. So that was the first time that we had the use of a single dose of gabapentin in cats before a veterinary visit. And that is exactly that sort of 100 milligram per cat dose. And that has been a really good place to start, I think, for many, many of our feline patients. The one caveat here that I would have is that we need to be careful in cats that have known renal impairment or kidney disease. There we should absolutely reduce to about 50% of that dose. So that's Jessica Quimby's work that looked at that looked at sort of gabapentin in cats with chronic renal disease or with impaired kidney function, and how we needed to reduce that. And sometimes if I have a very teeny tiny cat, sort of a 3 or 3.5 kilo fluffy, I might also go for 50 milligrams per cat. So I think we can absolutely sort of consider what dosing we might want to use for which patient. And of course, we can also think about milligram per kilogram dose. So I think if we're thinking about our standard 5 kilo cat and 100 milligrams per cat is a good dose, then, thinking about that 20 mg per kg dose is probably a good starting point. So if you've got a much smaller or a much heavier cat, then you might want to adjust your initial dose according to that sort of 20 milligrams per kilogram guideline. So that would be, I think, the original work that came out. And I think many of us started using gabapentin in cats, and it's been such a reliable pre-visit pharmaceutical, and we really use it very commonly. And the nice thing is it seems to be hemodynamically very safe. Yes, we can get sedation and ataxia. Sometimes we can get vomiting on gabapentin, but it's not that common to see marked side effects, and they absolutely pass as soon as the effects of gabapentin wears off. We would routinely administer gabapentin about 90 to 120 minutes before the vet visit, and we would expect it to last for about 6 to 8 hours. So that would be our kind of initial gabapentin dose. We then have a second paper that came out in JAVMA in 2021 from Krushka et al. I hope I'm pronouncing that name correctly, where they actually looked at cats that showed fear-based aggressive behaviors in the veterinary clinic. And there they kind of increased the dose of gabapentin to between 100 and 200 milligrams per cat. So we're starting to see that sort of initial shift to slightly higher doses, depending on the severity, I guess, of the fear, anxiety, and stress signs. And potentially also what we want to think about is, the size or the weight of the cat in relation to the dose that we use. So again, for a standard 5-kilo cat, we would be kind of up towards 40 milligrams per kilogram as a dosing range there. So I think that's something really nice to consider. Now, what happens if those doses don't do what we're hoping them to do? What happens if, if the cats are still quite stressed, if they're still showing fear-based aggressive behaviors, if they're still showing marked levels of FAS? Well, we can either increase the dose even further. So I have been known to use gabapentin up to 50 to 60 milligrams per kilogram. So I have been known in a 6 kilo or a, even heavier cat to use a 300 milligram dose of gabapentin as a one-off, which has in some instances worked. Another option here, however, could be to give a dose the evening before the veterinary appointment and then the day of the veterinary appointment, again, 2 hours before. So in some cats, and we've actually had a recent example of this at my clinic in Abu Dhabi, where we weren't really winning sort of with the standard and even slightly higher doses of gabapentin. We went to an evening before and morning of dose, and that seemed to change things quite a lot for this cat, and we did then get the desired effect during the veterinary visit. Now, this evening before and morning of is something that's used also for PVPs in dogs, gabapentin and trazodone combinations, or gabapentin and trazodone combinations, which we'll talk about in a second, in cats. And it is not documented anywhere, really. I mean, it's documented anecdotally, and it's documented in terms of it is mentioned in textbooks or, in review articles on psychopharmacology, but there's no actual study looking at whether there is better efficacy with a night before and morning of dose compared to morning of only. So we haven't got a comparative controlled study to prove this. However, it is often mentioned anecdotally. So I think that takes us straight to our second compound, and I am going to come back to pregabalin, but I just want to, because we've just mentioned this, takes us to our second compound, which is actually trazodone. And we have got a couple of nice papers looking at trazodone use in cats. And the one, again, that looks at trazodone for pre-visit appointments is a paper by Stevens et al. From 2016, who looked at single doses of trazodone on its own, and they used the dose of 50 milligrams per cat, given again around that sort of 90 to 120 minute mark prior to the vet visit. So trazodone as a sole agent is also an option. And then something else that I have done quite frequently, if gabapentin on its own hasn't done the trick, is I may have then decided to stick to a slightly lower dose of gabapentin and add in trazodone anywhere between 25 milligrams and 50 milligrams per cat. That means that I don't need to push the gabapentin up quite so high, and therefore have a greater risk of those adverse effects that I might not want, that kind of nausea, vomiting, maybe more marked sedation or ataxia. I can actually stick to somewhere between my 20 to 40 milligrams per kilogram of gabapentin and then add in that 25 to 50 milligrams per cat. of trazodone. And again, so if we think about 25 milligrams, that's 5 mg per kg, 50 milligrams for your average 5 kilo cat. I'm talking again, 50 milligrams would be 10 mg per kg, which is quite high. So I think if I'm using it in combination, I would probably start at 25 milligrams per cat or 5 mg per kg, depending on how heavy your cat is, and try that combination, which again has oftentimes really, really helped. And this is also a combination that I've used in some cats for air travel, where they've been particularly fractious and where gabapentin on its own maybe hasn't been quite enough. And that sort of gabapentin trazodone combination can actually be quite a nice combination for some cats. And again, you can do night before, morning of. So you can again do that sort of, double dose, if you like, 12 hours apart roughly before the veterinary visit. So that would be gabapentin and trazodone. Now let's talk about pregabalin, because for pregabalin, we actually have a licensed veterinary product, which is made by Orion Pharma. If you're in the UK, it is distributed by Domes Pharma, and that is Boncat. So Boncat is a pregabalin 50 mg per ml oral solution, which is licensed for the transportation to and examination at the veterinary clinic. And the paper that I'm going to put all these papers in the show notes that I'm mentioning here. The paper that I'm going to put in the show notes for this is the 2023 paper that Dr. Karen Overall also was co-author in. There are a couple of papers on Boncat as they developed it for approval, for FDA approval. I'm not going to list the first two. I'm just going to list this, the third one, which is the 2023 paper, which again is Boncat for use before veterinary visits. So it's a 50 mg per ml oral solution, and they have based the dose on, again, 5 milligrams per kilogram, which, if you do the maths, is going to be 0.1 mils per kilogram. So again, for your average 5 kilo cat, that would be half a mil, which from a volume point of view and from an administration point of view can be really beneficial for some cats. Now, granted, not all cats are going to love oral liquid administration, but for many cats that can be easier to administer than, hoping that they eat a gabapentin tablet or powder from a gabapentin capsule in some yummy food or a yummy treat. So that oral liquid has been shown to actually be quite beneficial from an administration point of view. So I think that in the countries where you can get Boncat, unfortunately, we can't yet get it in the UAE. However, I know it's widely available throughout Europe, and it's just also, I think, been licensed in the US. But where you have Boncat available, that would be a really, really nice medication to choose. Just from an administration, the fact that it's licensed, we have got the safety data on it, all that sort of thing point of view. And it has been shown to be also really helpful. And again, you can use it off-label in inverted commas, if you like, and give it the night before and the morning of. And again, it's intended to be given around 90 minutes before the vet visit. So pregabalin is absolutely another really, really good option there. So that's our kind of gabapentinoids. We've had a chat about trazodone. And there are two other groups that I want to talk about. And the first one are the alpha-2 agonists. And the reason I wanted to kind of dive into this is because we've just had a brilliant scientific paper presentation at the most recent Veterinary Behaviour Symposium which was in Seattle, which was just in June of this year. And one of the ACVB residents, Asher Feldman, talked about his study and presented his study all about the use of Sileo in cats for pre-vet visits. So there has been some initial kind of work on alpha-2 agonists and also the oral transmucosal administration in cats. But this is the first study that looked actually at the efficacy of Sileo gel in cats. And yeah, I just wanted to kind of share with you the highlights from that presentation, because it was such a cool presentation to listen to, and it sounds like they've got really nice effects from using Sileo with cats. So the research was done on 40 shelter cats. It was a placebo-controlled study. Sileo gel was used. in the normal sort of route of administration, or transmucosal, so given into the cheek pocket of the cats. So that kind of transmucosal absorption, which can be really beneficial and can act quite quickly. The dosing that was used, that for cats under 5 kilos were given 1 dot, cats over 5 kilos were given 2 dots, and that worked out to be around 5 to 10 micrograms per kilogram of dexmedetomidine or a transmucosal gel. Now, what they looked at in their study were the sedative effects, the anxiolytic effects, and the cardiovascular effects of the administration on those 40 shelter cats. And they used, so obviously what we want to, I guess, know not most about, but what we're very interested in is whether we had anxiolytic effects and whether the Sileo was going to be a good medication to reduce fear, anxiety, and stress in the veterinary setting. And in order to do that, they looked at two measures. They used the FAS scale, which you'll be familiar with if you're familiar with fear-free, so the fear, anxiety, and stress scale that was slightly adapted, but essentially is very similar to the FAS scale that fear-free have published for cats. And they also looked at the cat stress score, which is a second sort of measure of stress. Now, what they found in the Sileo group as compared to the placebo group was an improvement in the FAS and stress scores, which started at around 30 minutes after administration, reached their peak around 60 minutes after administration, and then started to kind of wane by about 90 minutes, which means that Sileo gel is probably effective for about 60 to 90 minutes after administration. So it's a lot shorter than the gabapentin, pregabalin, and trazodone medications that I mentioned before. So it's nice because we have a faster onset. So that means we don't have to give it so far in advance before we take them to the veterinary clinic. But we also need to make sure that we time it well so it doesn't wear off before we get the cats to the veterinary clinic. So that's just something to be aware of, is that much sort of shorter time to onset, but also that shorter duration of efficacy. In terms of sedative effects, they also noticed that the Sileo group had mild sedation, so not moderate, not severe, mild sedation at around the 60-minute mark, which I guess coincides with that sort of period of efficacy. And then the cardiovascular effects that they looked at were heart rate, heart rhythm, and then they also tested an indirect blood pressure, I think at 30 and at 90 minutes post-administration. And all of those measures were... there were no sort of extremes or very scary measures. There were no arrhythmias noted at all. Heart rate was within a certain range, up to, I think, about 220 beats per minute. And blood pressure, I think, also was within a range, but everything sort of within what we would expect an alpha-2 agonist to cause in a cat that had received that medication. So I thought that was super, super encouraging. In terms of kind of unwanted effects, so there had previously been reported in the previous work on alpha-2 agonists in cats, or especially kind of the oral transmucosal administration, hypersalivation had been noted, vomiting had been noted, lip smacking had been noted. And I think that the most common thing that was seen was hypersalivation, so ptyalism was seen, but only in the dexmedetomidine group. They didn't see any vomiting in those 40 cats, which is nice. And the lip smacking was seen in some of the dexmedetomidine cats, but also some of the placebo cats. So those were, I think, the things that were sort of most noted in terms of adverse effects. But everything else fell within the realms of normal, what they were looking at in terms of anxiolysis, sedation, and the cardiovascular effects were also, in a region that we would feel safe and comfortable with to administer Sileo gel to cats. So I thought that was so interesting. And I just, I love the fact that, we're having more options for cats now, because I think, with cats, we have been quite restricted to, I guess, gabapentin and pregabalin. Not restricted to, but I think that's what we use most commonly. And look, I get it, because honestly, For me, those medications in cats are so much more reliable than they are in dogs. So almost why would you use anything else? Plus, they're safe. We're familiar with them. We understand what they do. You know, as clinicians, we feel comfortable using those medications. But it's just really nice to know that we have other options. And you know, this presentation was a delight to listen to, certainly for me, to just know that we have some other options for cats. Now, I don't think that this study has been published yet. I don't know whether it's going to be, but I will ask the question. And I don't think it has been published yet, but as soon as it is, I will make sure that we add that into the show notes, the link to the paper, so you can have a look at that. But yeah, for now, I think that's a pretty good summary of what was in the presentation of that study. So staying with the alpha-2 agonists then, do we have any others that we can use? Well, I mentioned earlier the kind of, spraying injectable solution into the mouths of cats. And again, it wasn't what I wanted to talk about because I didn't really want to talk about sort of emergency or urgent use of PVPs for cats. But, you know, that is an option as well. And then I have absolutely heard a number of my colleagues use clonidine tablets or clonidine in cats. We've got no evidence, we've got kind of no studies, you know, nothing to sort of support that. That was really more of anecdotal use or, you know, true clinical use, I guess. And the reported dose that I've heard most commonly would be a quarter of a 0.1 milligram tablet. Now, I have to say, I've never used that myself because I kind of have never had to. I've always found with gabapentin, pregabalin, and trazodone, and now we've got this new option of Sileo. It's probably not something that I will be using very quickly, but if you can't get Sileo and if, you know, your other meds aren't working for you, that might be another option if you're comfortable to use something that's, you know, potentially doesn't have that much sort of supporting evidence to it. The fourth and final group I just want to chat about here are the benzodiazepines, because I know, again, that many of my colleagues really like benzodiazepines for cats, and the two that would be probably most commonly used as pre-visit medications would be alprazolam or lorazepam. Alprazolam is potentially shorter acting. Lorazepam is a little bit longer acting, but many of my colleagues really like lorazepam for cats. Again, myself personally, I haven't used many benzodiazepines as PVPs just because I haven't really felt the need to. And also, I'm always a little bit cautious about potential adverse effects of benzos in general. So that paradoxical hyperexcitement, potential disinhibition of behavior, makes them hungry, which could be a not massively bad thing at the veterinary clinic if we want to be giving them, you know, treats, licky licks or something while they're being examined. But if they are unwell, or if we want them nil peros or something, then that might not be a positive side effect to have. So the benzos for me probably are always slightly lower on my list. I also know that some of my colleagues have used benzodiazepines in air travel in cats really successfully. And again, I would say alprazolam and lorazepam would probably be the two most commonly used. Again, I have always found that I've done very well with gabapentin, pregabalin, and or trazodone. I would say the alpha-2 agonist might be too short acting for travel or for air travel. That's where something like lorazepam, if we are looking for a different medication class, might come in handy. But yeah, the benzos are just not something that would be my first line, I would say. So I think that's kind of it in terms of my overview of PVPs. I guess what I wanted to sort of highlight with this episode is we don't have to just use gabapentin. I think gabapentin is a brilliant medication. And as I've mentioned, it's been absolutely game-changing for me. We've got nice evidence to support it. We've been using it for a long time. It's safe. All those things that I've said. So gabapentin is great, but sometimes gabapentin isn't enough. And we don't want to push to that dose where we're seeing side effects that aren't so nice. So really just to let you know that there are other options that also have evidence behind them, right? So we've got papers on trazodone, we've got now the study on Sileo. So there is other evidence-based medication out there. And then, of course, remember Boncat our licensed pregabalin medication, which is an oral liquid, so might be much easier for administration. And depending on where in the world you are practicing, you might need to stick to the cascade where you use licensed meds first. So Boncat is another really, really lovely option. Okay, I hope you found that useful. I hope that's given you a little bit of something to think about. I hope you might consider that for the odd cat that maybe doesn't do quite so well on gabapentin on its own. And yeah, I hope you've enjoyed this episode, and I look forward to seeing you next week for episode 146. Bye for now.